At some point, most ladies have been made to take antibiotics because they were told they have PID, which may have not been the case. It is something that can quietly affect fertility, and it is mostly misdiagnosed. Hello, my name is Chinaza. I am a medical sonographer, and on this space, it is everything ultrasound. Today, let us talk about PID and what we see on ultrasound. What is PID? PID means pelvic inflammatory disease. It is an infection of the female reproductive organs, mainly the uterus, the fallopian tubes, and the ovaries. It usually starts from bacteria, moving upwards from the vagina or cervix down to the reproductive organs. The most common causes are sexually transmitted infections like chlamydia or gonorrhea, but it can also happen after an unsafe abortion, a poorly done procedure, multiple sexual partners, or having an untreated vaginal infection. Some women have obvious symptoms, others don't. The symptoms to look out for includes lower abdominal pain, abnormal vaginal discharge, pain during intercourse, fever, irregular bleeding, and sometimes, like I said, it is completely silent. Now, let's talk about what we see on ultrasound. In severe cases, we may see a thickened fluid fallopian tubes called hydrosalpinx. We could also see complex fluid collection called pyosalpinx, that is fluid containing particles. We could also see tubo-ovarian abscess, which is a serious complication. This simply means that the tube and the ovaries become stuck together and form a pus-filled mass. We could also see free fluid in the pelvis, or what we call the pouch of Douglas. We could also see adhesions, making organs look stuck together, and it gives a hazy appearance on ultrasound. And PID is very serious if it is untreated, because PID can lead to infertility, chronic pelvic pain, and even ectopic pregnancy. Please note, not every fluid in the pelvis or pouch of Douglas is PID. One of the most common mistakes in ultrasound practice is seeing every free fluid in the pelvis or pouch of Douglas and immediately labeling it as PID. Fluid alone is a finding, not a diagnosis. There are normal reasons why fluid can be in the pelvis or pouch of Douglas. Number 1 is ovulation, which is the most common. Number 2 is a ruptured follicle or a ruptured corpus luteum cyst. Number 3 is post-menstrual phase. That is, if you just finished seeing your menses, there's a possibility that there could be mild fluid collection in the pelvis or what we call the pouch of Douglas. And sometimes, even in pregnancy changes, there could be mild fluid collection. And then there are pathological causes of fluid in the pelvis or pouch of Douglas. Number 1, we have this PID, but it shouldn't be used alone. It can only be used when there are other features to support it. Another reason why fluid can be in the pouch of Douglas is ectopic pregnancy. And number 3 is ruptured ovarian cyst. Another reason is appendicitis. Fluid can track into the pelvis in this case. Number 5 is pelvic malignancies like ascites. So there are normal reasons why we can see fluid in the pelvic region, and there are also pathological reasons why there could be fluid in the pelvic region. So instead of using fluid alone, we look for a combination. Number 1, we look out for probe tenderness, that is, you feel pain when we apply pressure. Number 2, there is loss of normal adnexal anatomy due to inflammation that causes this hazy appearance on scan. And in severe cases, the ovaries and fallopian tubes show severe fluid collection or abscess collection. Like I said earlier, free fluid alone in the pelvis should raise suspicion, but not conclusion. On ultrasound, PID is diagnosed when imaging findings correlate with clinical symptoms and laboratory evidence. For follow-up and correlating tests for proper clinical correlations, we have laboratory tests like full blood counts, where white blood count evaluation suggests an infection, and we also have high vaginal swab. Other clinical correlations include fever, cervical motion tenderness. In this case, you have to be examined by a clinician. We also have low abdominal pain pattern. We have vaginal discharge history. As sonographers, our role is not to label every fluid as PID. Our role is to describe findings accurately and guide clinical correlation, because mislabeling can lead to mismanagement and abuse of medications, especially antibiotics. If you have learned something new, follow for more real ultrasound insights. If you have any more question or confusion or experience you would like to share, feel free to drop it in the comment section. Don't forget to like, share, and subscribe, and I'll see you in my next video. Also, don't forget to join my live streams every Sunday by 4 p.m., where I'll be there to answer your ultrasound related questions.